Do you suffer with lower back pain, go for massages regularly but never really get to the root of the problem? The masseur only ever really massages across the back of the body. Well, often the problem is a muscle called the psoas. It comes from the back but across the front of the hip to the inside of the thigh. In yoga we know it as the muscle of the soul, and it can be a storage for lots of emotional energy. It can be tight or it can be weak, or a mixture of the two. So these little exercises to help strengthen it and stretch it, and hopefully that might sort out your issue. So what you're going to do is you need a wall, and that's about it really. Your foot is going to touch the wall, the front foot, and then you'll come down onto the knee of the other leg. There is a line from your ear, through your shoulder, through the hip, to the bottom knee. And the hands can just rest on the wall. They're not really doing much, they're just out of the way. We need to engage something called the pelvic floor. And so for want of a better description, it's the feeling you get when you contract and try to stop your pee mid-flow. On top of that, there's a real drawing in of the navel and a tension through the butt cheeks themselves. You're going to hold that tension and try and lift the front leg off the floor without letting your hips move. So you shouldn't see any wiggles there. Stays nice and still, and you lift the front leg as high as you can go without having those hips move. To start off with, if it's weak, you might not be able to do it, and you'll get into position and that's all you can do. But just the effort of trying to lift the leg will begin to build the strength up, and eventually you'll start to be able to lift the leg. Once you can lift the leg off the floor, then you can hold it for a couple of seconds. As it gets stronger, maybe 5 seconds and 10 seconds. And I want you to do 10 on one side and then switch over. Same position, we're going to do the same thing on the opposite leg. So squeeze, contract, tense, don't let the hips move, and lift the foot off the floor. Again, as best as you can do. Once you've done 10 on either side, then we're going to stretch out that same muscle. So same position, make sure your back foot is tucked underneath so you can press into the floor with the toes. What you're going to do then is squeeze the bum and contract the stomach and try and tilt your pelvis underneath. So it's like you're trying to rotate underneath and bring your pelvis towards your face. Only go as far as you can go feeling the stretch. It shouldn't be painful. So you tuck underneath and you're going to hold it. The stretch you should feel will be across the front of the hip. If you're tight in your thighs, it will probably go down your thigh as well, but it also will feel like it's coming in towards the groin a little bit. And you'll hold that for 30 seconds, maybe a minute, depending on how tight it is. And it should get to a point where it almost feels like it melts. That's where you're looking for. When it melts, you can go tuck under a little bit more. And again, just wait 20-30 seconds to give it a bit of a stretch. Once you've done one side, switch over, foot touches the wall again, same position, toes are tucked underneath. Squeeze underneath and rotate that pelvis under. So it's like you're trying to shorten the distance between your lower rib and your hip. Hold that, 30 seconds to a minute. Again, you should feel it melt, and then you can tuck underneath a little bit more to give it a little bit more of a stretch. Do that every day, and then see how your back is in maybe a week's time.